Hi, good afternoon. This is Professor Schleich here, and I'm going to be doing a review of the last two chapters of our ICD-10 coding manual. So you see to the right of my screen, I'm going to be reviewing Chapter 20, External Causes of Morbidity. That covers the codes B00 to B99, and then we'll do Chapter 21, Factors Influencing Health Status and Contact with Health Services, which covers the codes V0 to Z99. I'm going to do just a review of the PowerPoint and also of the coding manual. So if you open up your coding manual and let's start at Chapter 20, you'll notice that the Chapter 20 external causes of morbidity. And again, some of the basic notes of the external causes of morbidity, and I always tell my students to open this up, open up your chapter, take a quick overview of the entire chapter. Before you even start your PowerPoints, before you start your classes, before you start anything, start with your official guidelines, which is Chapter 20. Review through the and kind of make your way down through those so that they catch your eye. To me, I think it helps you to understand what you're going to be coding out, how it applies to the questions or diagnosis that you're going to be utilizing. So let's just take a quick look here. So the chapter guidelines for morbidity should never be sequenced as the first listed or principal diagnosis. That is the first thing to remember is that they are never utilized as a principal or of a first listed diagnosis because they're external causes of morbidity. So when you look through your codes, you'll notice that they are the VW and Y codes. So our first example, if you actually look in the coding manual, is an actinic reticuloid due to tanning bed use. And so we're focusing on, we have a diagnosis, which is L57-1, and then we have exposure to that tanning bed initial encounter, which is the W code. So that is your external causes of morbidity or of something that happened. So a definition of the external causes are intended to provide data for injury research and evaluation of injury prevention strategies. These codes capture how the injury or the health condition happened or the cause of it, the intent, was it unintentional, accidental, intentional, such as suicide or assault, the place maybe where the event occurred, and the activity of the patient at the time of the event, and the person's status, that is, were they civilian or military. So a little bit further explanation of this chapter also in the official guidelines tells you that there is no national requirement for mandatory ICD-10 external cause code reporting unless the provider is subject to a state-based external cause code reporting mandate or these codes are required by a particular payer. Reporting of the ICD-10 code in Chapter 20, external causes of morbidity, is really not required. So in the absence of a mandatory reporting requirement, providers are still encouraged to voluntarily report external cause codes as they provide valuable data for injury research and evaluation of injury prevention strategies. I reviewed this in my last lecture, and I'm just covering it again as an overview of this activity to go along with Chapter 21 also. But again, your PowerPoints will hit every category within there, and as I stated, please review through the different types of accidents. You can identify what happened to the patient, maybe the fractured femur, and then give the reason. Was it a car accident? Were they hit by something? But as you make your way through the book, chapter manual, you'll see that the external causes of morbidity and the accident section use goes from A through Z, definitions related to transport accidents. So they're saying a pedal cycle, a pickup truck, jet ski, a motorcycle, etc. You can be very, very specific to how a person was actually injured. So again, why are those important? It's important in the research process where can we say that we're getting from maybe a zip code 57000, we're seeing a lot of accidents coming in. And from there, what are the accidents? You can query that information, especially orthopedic physicians, different types of facilities, your rehab facilities may want to query that to see if they have enough staff. So let's see, we queried the 2018 for different types of accidents, and what are we seeing? What's our therapy department working on the most? Do we need to add people? Do we need to reschedule people, etc.? So it is a valuable tool for internal mechanism, but also for our state. A lot of our external causes of morbidity are mental reporting. You'll find that there's abuse, adult or child abuse is listed within this chapter, etc. So exposure to different chemicals or elements, things like that are also covered underneath this. So I will not go through these verbatim, the PowerPoints, but they are available to you, obviously. And again, you are actually, these codes capture the external cause of injury or health condition then. So, and I'll just take a moment as we kind of look through these again, and I'll hit some of the highlights of that. Your general external causes, the guidelines, the occurrence guideline activity, occurrence, place of occurrence, excuse me, if the reporting format limits the number of external codes, etc. then. So we have child abuse, unknown or undetermined, terrorism, external cause code again. So your diagnosis will be coded from Chapter 19, which we just reviewed, injury, poisoning, and certain other consequences. However, an external cause code may be used with a code from other body system chapters then. So again, maybe many, but not all, of the B00 to Y99 codes require a set of characters to indicate whether a health encounter was initial, subsequent, or sequential, just like your Chapter 19 did also. The entries used in the main terms to identify, again, so if you're looking at your index, you could be looking for accident, drowning, exposure, force of nature, falling, slipping, activity of the person, place of occurrence, as external causes. I do think sometimes that's a hard part for students, is that they aren't sure where to find the information in the index. So again, kind of open your mind, and if you start to look through Chapter 20 in regards to that, it will trigger how you will find those. Okay. So again, some of the broad examples of that are walking, running, ice, caregiving, food preparation, etc. How the sequence of place, where does it happen then? So your seventh character of an external cause code may always be the seventh character in the data field. So a code that requires 7 characters, not 6 characters long, which we use again, which we've learned a placeholder of X must be used to fill in the empty character place in. Multiple causes of external causes of injury, you'll see terrorism, transport injuries, activity, external causes, etc. You do a lot with the external piece of it then. A patient with a sequela of a past injury or illness is coded as follows. You code the residual effect, the sequela, or the external piece of it again. So you've made your way almost through the coding manual. You should be very familiar with your coding process, the index to the tabular, and then as I talk about backtracking, you start with the code, you move up to the category, the section, the chapter, and then read through your official coding guidelines to see if there are any notes that would pertain to that piece of it. In this section, we also have military operations, suggest operations of war, military operations. Terrorism also defined in this, which we have not had previously. It's been in the code manual for a while, but I didn't have it when I first started to code. Place of occurrence, again, identify the location where it was injured. Is it available? The status codes indicate if it was during military activity or non-military, with the way it worked, etc. You may have a work comp. And also, these codes are not applicable to poisonings, adverse effects, incidents, or late effects. So again, it is exactly what it says, external causes of morbidity. So, okay. Now let's move into another quick kind of fun little chapter that's an add-on for the coding piece of it. Let's this one. And we're going to talk about the factors that influence our health status and contact with health services. So with this chapter, let's just open up our coding manual. Your last, very, very, very last chapter. Wow, you made it all the way through. So let's just take a look at these. In your coding manual, you talk about the Z code. So these start with Z00 to Z99. Again, it's pertinent that you review your first official guidelines before you actually even start in this chapter. There's a lot of information in this chapter, and it can be very useful in terms of facilities utilizing it. So when you look at it, use of Z codes in any healthcare setting may be used as either a first listed principal diagnosis in the inpatient setting or secondary code depending on the circumstances of the encounter. So certain Z codes may only be used as first listed or a principal diagnosis. So in the first example that they give in our coding manual, a patient with middle lobe lung cancer admitted for initiation of chemo. So they're coming in for the treatment of that, but you're looking for encounter for anti-neoplastic chemo, and then you're going to code out the malignant neoplasm of that middle lobe. So Z codes indicate a reason for the encounter. Z codes are not procedure codes. A corresponding procedure code must accompany a Z code to describe any procedure that's performed. So in this case, they would be coding out the chemo piece of it. So if you look through C, categories of the Z codes, in our PowerPoint also will hit that. Bring us up to speed here. So we're looking at that. Your category contact, exposure, inoculations, and vaccines will fall underneath this also. So as we look at our coding manual, just kind of back up to this again, we'll go to history of, and then we have screening, we have observation, we have aftercare, we have follow-up, donor, encounters for obstetrical and reproductive services, we have newborns and infants. A lot of students ask me in regards to that, how do I find that code? So encounter for routine child health exam, or the Z38, the live-born infants, which we just covered a couple weeks ago in chapter. 13 is routine and administrative examinations, and those are also Z codes. And then miscellaneous Z codes are prophylactic organ removal, and also they give you a little section of those. They're non-specific Z codes, something that maybe what you're utilizing at that point of contact with that person receiving the services then. So, okay, so just a little brief overview. There's 50 of these PowerPoint slides. I will not be going through all those. But again, what we're looking at when we talk about factors influencing the health status and contact with health services, again, why are they coming in for that? So the first one, we're kind of looking at personal history of malignant neoplasm. Use additional code to identify the reason. So in this case, alcohol use. History out there's several more. A lengthy list of coding guidelines have been published for Chapter 21. So the guidelines are an excellent teaching tool for learning how to code the conditions and reasons for healthcare visits using Chapter 21. So you'll notice that if you are a well person coming into a clinic, they are probably going to be utilizing a lot of these codes. Maybe I'm coming in for a follow-up, so you're going to use a follow-up examination for treatment, if it was a malignancy, a Z09, etc. So in your healthcare setting, in a hospital setting, you're not probably going to see a lot of these. You are going to see more definitive diagnoses. They're not coming in to be in the hospital for an examination. Okay, that's that place or medical necessity would be in your clinic, not in a hospital type setting. So use of Z codes in any healthcare setting indicate a reason for encounter. Again, we have contact, exposure, inoculations, and vaccines, status, personal history of cancer, screening, observation, aftercare, follow-up, donor, counseling, encounters, newborns, and routine. I kind of just went through some of that through your coding manual, but the PowerPoint does address that. And you have specific guidelines to address the miscellaneous piece of it then. Immunizations not carried out and why, and that may be important. Why didn't they carry them out? Was the child sick? Did the parents refuse to give that inoculation or immunization, etc.? So things like that can affect your scheduling and how your clinic is run or how your facility is running that piece of it. You may use these codes to address that. What are some of the issues with that patient that's preventing them from understanding their treatment at the time? Are they coming back numerous times? The Z code would identify that they maybe just are illiterate, maybe can't read English as their second language, etc. So, okay. So the use of the codes can arise in two main ways. When a person who may or may not be sick encounters the health services for some specific purpose, such as to receive limited care service for a current condition, to donate an organ or tissue, to receive prophylactic vaccination, to discuss a problem which is not a disease or injury in itself. Number two, when some circumstances or problem is present which influences the person's health status but is not in itself a current illness or injury. So again, as a visit then. Z-code classification are available for the following then, and these are excellent examples of that. So make sure that you review through that. So we have our Z codes. If you're going to hit the main term, describe the reason for encounter and why are they coming to the visit. So the examples of the words that indicate the reason for encounter or healthcare services are, you can use encounter. Medical observation for other reasons. Reasons, again, talks about the newborn for suspected diseases or conditions within the first 28 weeks of life. Encounter for follow-up for malignancy, that you talk quite heavily about malignancies. Genetic carrier, some of the screening. Just a lot of what the title tells you. Influencing health status and contact with health services. Why am I coming in? Encounter for immunization, encounter for under-immunization status, birth control, procreative management, pregnancy testing, pregnancy state, screening, prophylactic surgery. I'm coming in maybe to have surgery. They'll use the Z20 code, remove organ, maybe a tubal ligation. Encounter or attention to artificial openings. I have a colostomy. I come in because I want them to remove or replace the catheter. Orthopedic aftercare, etc. Procedural aftercare. So again, I'll just kind of breeze through these PowerPoints and you can review them on your own. It's a very, very beneficial chapter for, like I said, for the facility to utilize in terms of why are people coming to our facility? What is their most heavily utilized encounter for service? And maybe it would apply to scheduling. Can I hire a new person? Does it mean we should put a physical therapist on staff or an assistant, etc.? Do I need to bump up our continuity of care? Do they need to be seen at our outpatient physical therapy? Set up those types of appointments. So, okay. So in light of that, those are your last two chapters. The ICD-10 coding manual, external causes of morbidity and factors influencing health status and contact with your health services. Please do yourself a great review on these and review through your chapter guide, official coding guidelines and coding manual. If you're using a textbook of some kind for class, go back and compare those back and forth. Do as many exercises as you possibly can. You can start in your coding manual and do the shaded lavender colored exercises. It will give you an idea of how to specifically use the guidelines. This, you can't use this as a principal diagnosis, etc. I do find, and I've coded for many years, that if I review through those first, everything else seems to fall in place. And it will come to my memory that hey, we addressed this in the coding guideline. I need to go back to that. It's not like we have millions and millions of coding guidelines. So just the little things will become important to you as you finish out your coding career here with the classes. So thank you very much today. I've enjoyed having you in this presentation, and have a great rest of your week.